Hi, this is Josh Yamamoto. Welcome back to Real Doctors, Real Medicine. We're continuing our multi-part discussion on the prevention of vascular dementia. So I invite you to watch our previous episode. Just as a quick review, dementia is whenever our brain doesn't work quite the way we'd like. There are many forms of dementia. We often use the synonym Alzheimer's to mean dementia, but Alzheimer's is a very specific form of dementia. There is also the component of circulation. Blood flow to the brain is essential. If you don't get enough blood flow to any organ of the body, that organ won't work so well, and over time, our circulation will naturally change. So, vascular dementia or senile meaning age related, is due to the interrupted or inadequate or insufficient blood flow to the brain, which can happen slowly over time, leading to abnormal brain function. Now, in the last episode, we talked about how with time things will naturally change, that we should think of life as a series of processes, not just a bag of diseases, particularly aging. I mentioned I give a lecture titled There's Almost No Such Thing as Heart Disease, It's Just Natural Aging. And if we think about the processes of natural cardiovascular aging, we can work on optimizing the blood flow to the brain. Three key things will happen to absolutely all of us as we go through time in regards to the heart and circulation. Many processes, we'll get to that. Our broadcast is brought to you by the Foxall Foundation, which is dedicated to helping everyone age well, dedicated to understanding how we age and how do we navigate that. So, from a cardiovascular standpoint, three things that happen to all of us. One, chronic vascular inflammation. With 100,000 heartbeats, we have relentless wear and tear that beats up our arteries, and our arteries age. Please go back and listen to the previous episode because we talk all about how that happens and what we can do about it to prevent and in most cases actually stop vascular aging. Isn't that remarkable? If you don't have good pipelines delivering blood into and throughout the brain, guess what? You're not going to have as good blood flow to the brain. The second process is vascular stiffening, which leads to pressure changes, and that's what we're going to talk a little bit about now. The third process is that our heart beats when it's told to beat. There's an electrical signal that tells our heart to beat, and our ability to generate that electrical signal declines as we get older, no matter how strong and robust our heart is. So that will be up next. But the second thing, vascular stiffening. The heart's a pump. It's a pump. It's got to pump blood throughout the body, and the most important organ, at least from a heart standpoint, is to send blood to the brain. And so you carry that blood through the pipelines. The pipelines are the arteries. Arteries carry blood out. And then it goes into all the tissue of whatever organ, and the blood will come back to the heart through the veins. The veins are soft, squishy, and pliable and do all sorts of things. But our arteries are more rigid pipelines. They're actually stiff. Would you believe that in ancient times, Greek anatomists would look at fallen soldiers on the field and they'd see an artery, and it's a stiff, kind of rubbery tube. And because the blood runs out of arteries after you die on the battlefield, they actually thought the arteries carried air because they maintain their form. The veins are soft and pliable, and the blood will pool there. We need to have intact arteries. Arteries don't carry air, by the way. They do carry blood that has oxygen and all the vital everything to get to every tissue, every cell, every organ of the body. So when we're young, our arteries are quite flexible. We're growing. Arteries are mostly made out of collagen, which is a long protein. Now, over time, collagen changes. I mentioned previously that I have a physics degree. I'm a very mechanical guy, so I understand what happens when a soft rubber tube turns into a copper pipe. The flow through it can change, and we can understand that, and we can anticipate it. I'm not a biochemist. With great joy, I'm not a biochemist, but these biologists have told me or tried to teach me how collagen is a long protein and it loses its elastance. It's an incomplete protein that changes over time. And yeah, there are a lot of things that can influence that. Things like nicotine, for example, seem to influence that, and our arteries get stiffer. That's not the same thing as our artery getting blocked. That's last episode. A pipe full of rust has gunk in it. That's atherosclerosis. A pipe that's hardening up and stiffening, that's different. That's arteriosclerosis, if you want to get technical. So you have a stiff pipe. In general, stiff pipes are under higher pressure. Pump against a stiff pipe, you'll have a higher pressure. And so we measure blood pressure. I have to realize that Blood pressure is the measurement. Blood pressure gives us a number. It is a measurement of something. What? It's trying to tell us something about how strong our heart is, how much work our heart has to do, and something about the health of the arteries. We tell everybody that hypertension is a disease. High blood pressure is hypertension. But again, the blood pressure is the measurement. The issue is, how are the arteries faring? How are our arteries aging? And you know what? This is a tough one, but pressure doesn't matter nearly so much as flow. Flow. You have to deliver fresh blood to every organ in the body, particularly the brain. Okay, so why do we measure blood pressure? We've made the observation over time that people with higher blood pressure often have cardiac and vascular problems, like heart failure, strokes, but what causes that? And again, this is all about understanding the brain needs to have good flow, so we want to keep the system working. So we tend to use heart disease as a catch-all term, but heart disease is not one thing. When I train my medical students, I tell them, look, I don't want to hear you say the word heart or term heart disease without putting an adjective in front of it. Do you have heart disease from blocked arteries? Do you have coronary artery or atherosclerotic heart disease? Do you have heart disease from an overworked heart, hypertensive heart disease? Or do you have heart disease from a heart that's too irregular? That's conduction disease. Or do you have heart disease because you have a bad valve? There are a lot of reasons you can have heart disease. They're not all the same. Saying heart disease is like saying my car has engine trouble. Really? I'm going to go to a mechanic. Hey, I know what's wrong. You have engine trouble. I already knew that. I brought the car to you. Why do I have engine trouble? So you can have engine trouble, you can have heart disease, you can have poor circulation for more than one reason. It's not one thing. So we're mindful of blood pressure. Everybody's arteries will stiffen over time. Men do this in very different ways. I'll get to that in a moment. But as your artery gets stiffer, that stiffer pipe will have higher pressure. That higher pressure means more cardiac work. If we ignore that, we can overwork the heart. This takes years to decades, but it'll happen. And if you overwork the heart, you beat it up and it doesn't work so well. When the heart's not working so well, we typically call that heart failure. Again, there's a lot of definitions of heart failure, but suffice to say, if your heart doesn't meet your needs, it's failing to meet its needs. So any circumstance, for any reason where your heart's failing to do its job, for now, we can call that heart failure if we want. Let's just say we don't want to beat up our heart. Why? Because our brain likes to get good blood flow. And if we don't have good blood flow, we're not going to get enough blood flow to the brain, and the brain will eventually suffer. So part of preventing dementia is maintaining good circulation. Actually, that's a big part, and perhaps the most important, because we have control over that. So pressure rises over time naturally. That doesn't mean everybody has a disease. There's a lot of talk in the press about, oh, we all have this disease and this is bad. It's like, look, pressure's a measurement. We all age. We have vascular aging. Our pipes get stiffer. Stiffer pipes mean higher pressure. Higher pressure means more cardiac work. Now, a little bit on how men and women differ. Men start getting stiffer pipes typically in a very methodical, linear, we just progress, starting often in our 30s, sometimes younger, and we just get stiffer over time. And we like it. Higher pressure often means better blood flow, and we can be higher performing, and we feel great. And who wants to tell a 40-year-old man you have a disease and you got to take a pill? But if we don't, you can wear that heart down in 10, 20 years, and this 40-year-old running pressures of 220 over 120, which happens way more often than you might think. I'm sorry, when is the last time you checked? Because nobody said this gives you symptoms. It just methodically beats up your heart. And so come around 60, your heart's beat up, it doesn't work so well, and you have forms of heart failure. It also changes the heart. When you beat up the heart, the muscle will thicken up, there's back pressure, different parts of the heart can stretch out. And guess what? When you do that, the heart has a real hard time staying regular, and it starts to become irregular. We're going to spend a lot of time in the future talking about atrial fibrillation, but high blood pressure that's undertreated or not managed well is one of the major contributors to why our heart changes and is more likely to become irregular. And then an irregular heart doesn't allow for smooth blood flow, and if you don't have smooth blood flow, the blood tends to clot. A stroke is a big blood clot in the brain. Lots of little blood clots just whittle away brain function. Again, a pathway to vascular dementia. The micro cumulative interruptions of blood flow, little bitty clots, which can happen from irregular heartbeats, which is much more likely if we don't do a good job treating your blood pressure. Women are different. Ha, shocker. There you go, newsflash. Women are different than men. Now, women tend to be much more flexible, at least in a circulation standpoint. Easy to understand if you think a pregnant woman has to increase blood volume so much. And their arteries are more like these soft, rubbery tubes. When women get older, so 60-year-old women, postmenopausal, by the time you get to 70, there can be a very sharp decline in your vascular flexibility. In other words, women often have a very low blood pressure for a very long time, and then suddenly they're 70 years old and they go to a gynecologist. It's always a gynecologist because that's who they see. And they put one of those automatic cuffs on their arm. They squeeze it up. Now, the automatic cuffs are trying to squeeze that pipe shut. You squeeze that pipe shut, you have to you're not just measuring the pressure, you're measuring the pipe stiffness. So imagine, if you will, you're holding a copper pipe in there and you're trying to squeeze it shut. You can squeeze all day, you're never going to squeeze it shut. So the automated cuffs can often dramatically overestimate pressure. Now, the fluid mechanics are even more complicated, and the pressure can go up and down and can be variable. And so you have to remember that auto cuffs, particularly in women that are over 65, can significantly overestimate pressure. That doesn't mean we ignore them, but we just need to understand what it means. Now, if you have a copper pipe, that can be great for delivering flow, but you have to have enough push behind it. It also means that if your pumping diminishes, you can have an abrupt drop in blood flow. What? What I'm saying is that what matters is good blood flow to the brain. Blood flow, not simply blood pressure. Blood pressure is often a follower. As things change, blood pressure can go up. That's supposed to. You'd be amazed at how high your blood pressure is when you exercise, and you have no way of knowing unless somebody's checked it for you. That's why we do exercise testing, in large part to see what is your blood pressure response to exercise. Because you don't want to overwork the heart, because you need the heart and your blood vessels to deliver good blood flow. Okay, what does this mean for real doctors practicing real medicine? It means we try to help all of our patients understand that your arteries naturally age. The atherosclerosis and the plaque we talked about last time, you can stop that. Don't feed it with diabetes, don't smoke, and when your doctor asks you to take a statin, take the statin or alternatives. The stiffening happens in everybody. We don't want that to happen because it's going to make things harder for the heart and for everything. You can push that back with regular exercise. That's where exercise matters. If you listen to our podcast, the last one on atherosclerosis, I didn't talk much about exercise because exercise actually doesn't stop the inflammation and the rusting and the plaque buildup, but exercise does marvels for keeping the arteries from being too stiff. Now, they're still going to stiffen, but you can delay it a long time. Exercise also teaches our heart, or helps our heart remember how to augment, how to increase blood flow on demand. So I cannot emphasize how important exercise is. I can't do that for you. I have a pill for most everything, but I don't have a pill for fitness. That's on us. We have to do our own exercise. It matters. It is not sufficient to prevent all vascular aging. And again, the plaque has virtually nothing to do with the exercise, but the stiffening of the arteries does. Now, when our arteries do start stiffening, we don't really want that to build up over time, which is why we, quote, treat high blood pressure, end quote. What we're really doing is improving vascular health and protecting the heart from being overworked so we can deliver good blood flow to the brain. Exercise helps, so do medications. The right medication, the right person at the right time. There are all sorts of blood pressure medications. One of the more common ones we use is something called an angiotensin blocker or an ACE inhibitor, which is roughly the same thing, only it makes you cough. The idea is that there are hormones in our body that naturally occur that help our arteries stiffen to keep blood pressure up, and over time they wear things down. So we have medications to help us cheat when we need them. The challenge is young men in particular don't want to hear it and they don't want to take the medication. Our older medications for blood pressure were kind of awful. We recognize that high blood pressure led to problems, but we really didn't understand the biology of how an artery ages. So we just use blunt tools like, here, take a water pill. I'll dehydrate you. Urinate all day. Yeah, if there's less water in the tank, the pressure's going to go down, but it's miserable and nobody liked it. We can also lower pressure by completely blocking adrenaline. Now, blocking adrenaline in the right person at the right time is extraordinarily important, but if you give people so much medication to take all of the adrenaline out of life, you just feel like a slug all day and nothing works right. So treating blood pressure got a bad rap. We need to think of it more as, how do I manage my vascular aging to not let my arteries get so old and stiff, because I don't want to beat up my heart. The arteries also in the brain have to be able to provide a good avenue for blood flow. We don't want them to fill with gunk. That's plaque. That's the last talk. But we want to make sure the arteries themselves are healthy. These older, stiffer arteries are a problem. They don't change with our needs. They don't augment blood flow. And as you might imagine, older, stiffer arteries are more likely to rupture and have all sorts of trouble. So this is why we want to maintain the health of our arteries. We have a tendency to undertreat blood pressure when we're young, mostly in men. And we have a tendency to overtreat blood pressure when we're older, mostly in women. And people are always asking, what's the ideal blood pressure? Really? What's the ideal blood pressure for whom? What's the ideal blood pressure for a 75-year-old man or a 20-year-old woman? What's the ideal blood pressure for somebody who's got plaque in their arteries or has a funny heart valve or has this, that, or the other? We keep changing our requirements because what we're trying to do is find a singular average that works for everybody. Guess what? We are not averages. We are not a singular average. Everybody is unique. Now, there are some consistencies, but the consistency is the theme. I want to have a healthy heart. I want to have healthy arteries. So now you could ask yourself, how do I know? How do I know the health of my heart and arteries? That's where a cardiovascular doctor comes in. Notice our first talks here are on the prevention of dementia. Why are these talks given by me, a cardiologist? Because if I can't get good blood flow to your brain will suffer. You don't ask a brain doctor how to keep the heart healthy or keep your arteries healthy. That's a cardiovascular issue. So you could ask your cardiovascular doctor or your internist or your primary care provider to say, don't just check my blood pressure, tell me how my heart is working. We can look at the heart. We ultrasound it all the time. It's called an echocardiogram or cardiac ultrasound. That's how we examine the heart. I'm sorry, it's the 21st century. The stethoscope was invented in the 1800s. It's remarkable. I can spend a half an hour listening to your heart and detect all sorts of wonderful subtleties, or I can just look at it. I can just look at it and know. If your pressure's been too high, your heart changes. I can see that. This is thicker, that is wider, this moves this way, this doesn't move that way. There's all sorts of things that I can simply see. Why are we doing the echo? To see, do you have long-standing, undertreated pressure changes to the heart? Because that can lead to irregular heartbeats and impair cardiac function and all sorts of things. I can just tell. Also, I love it when I have patients come to the office and they say, oh, I need to sit still and not cross my legs and breathe 3 times or whatever, because that's gonna affect my pressure. You know what? You get up, you move, you walk, you're active. I'm not even all that interested in your pressure when you're perfectly calm. I'm more interested in your pressure when you're riled up. Because I'm sorry, we get riled up. We're active during the day and whatnot. We're under stress. I live in Washington, D.C. I drive on the Beltway. Who am I kidding? I live in Washington, D.C. There's all sorts of stress. So looking good in a resting, comfortable state is of modest interest. How does your heart and circulation hold up under stress? It's not a judgment to say, oh my goodness, my arteries have aged and I have stiffer pipes. It's just an observation of how you're aging. And you can run all the time. You can be marathoners and you still have a loss of vascular compliance and a stiffening. And so we want to see your pressure under stress. How do you do that? You measure it. Virtually every patient that I meet, if they can walk at all, I'm going to make them go for a walk and measure their blood pressure. I put them on a treadmill. In the old days, we used to call this stress testing, but that really makes it sound like a pass-fail sort of thing. What we really want to do is a functional study, a complete functional assessment. I will watch you exercise. I will take pictures of your heart, and I will measure your blood pressure. Again, if you don't want to be distracted by the stiffness of the pipe, you have to use a stethoscope, which means you can't measure your own pressure. Your doctor or somebody who's good with a stethoscope has got to do that for you. All of our nurses and techs used to always use stethoscopes, and now we've gotten a little casual and just use the machine. The machine to check your blood pressure is fine for young people, but it's not calibrated for older people or older women, so you have to understand what it's telling us. And you could have a perfectly normal blood pressure sitting still and have pressures over 200 as soon as you start walking. Don't panic, but understand your arteries are getting stiffer. Now, I mentioned we undertreat blood pressure in young men because they don't want to take a pill or, you can only exercise so much. When women get older and they have that loss of vascular compliance and their arteries get stiff, we need to make sure they still have good blood flow to the brain. If you drop your pressure enough, you'll faint. So lower blood pressure over time can be much more of a problem because you know what? It goes up and down. It goes up and down. It's supposed to go up and down. It's supposed to be high under stress, and it can go down at any time for lots of reasons. And an abrupt drop in pressure means we won't have good enough blood flow. Now, I'm not a neurologic intensive care doctor, but typically when people have a brain injury, they do something called permissive hypertension, meaning we need to maintain good blood flow to the brain, so don't let the pressure drop or the brain doesn't get good blood flow. So the message is you need to have good blood flow. The answer isn't just blood pressure. If we give a 75-year-old woman too many pills because we don't like a number and she starts fainting all the time and doesn't have enough blood flow to the brain suffers. And if we have a 40-year-old man who's got these pressures over 200 but feels good and doesn't care because he can still do triathlons, we understand that your arteries are going to be different and they're going to age over time. So we are all unique. Just simply ask where we are and think about, what am I doing to maintain best possible blood flow? As we get older, things naturally change. Remember, I mentioned that there are 3 things that happen to everyone's circulation. 1, wear and tear, which gives us plaque. 2, vascular stiffening, which influences our pressure and influences our flow. 3, the heart's rate and rhythm changes. This is enormously important, not when we're young, but when we're older. When we get older, if our heart gets slow, there's not enough blood flow. We're going to go into that in great detail. How does that relate to blood pressure? Everyone measures pressure, but you know what? If you don't have enough blood flow to parts of your bodies, like your kidneys, for example, they cry out and say, oh my gosh, give me more blood flow. And they release all sorts of stress hormones like adrenaline to say, please, give me more blood flow. Beat harder, beat faster. Give me more blood flow. The brain is saying, give me more blood flow. But you know what? Not everyone's heart will beat faster on demand when we get older. And so what happens? The blood pressure surges up. So sometimes these blood pressure rises are really telling us the problem is somewhere else. Blood pressure as a measurement is often a follower. Something else is going on. What is that trying to tell us? So our goal to prevent dementia is to have best possible blood flow. Remember, I'm just talking senile, meaning age-related vascular dementia. We need to have intact arteries, healthy pipes, so you can't have vascular inflammation, but that's easy enough to suppress. Take the right pill at the right time. We want to have healthy arteries that are flexible as possible, that allow for our increases and decreases in blood flow without overstressing the heart or having too low of a flow. So we don't want pressure too high or too low. So I know everybody wants a simple number. I'm sorry, it's not a simple number. It really is about your health. And how are you going to know how your heart and circulation works? You really should ask your doctor. One of the most important things you can do to maintain your health and to navigate aging, and we think of health as living as long as we want, as well as we can. It's not about avoiding anything. It's about embracing that things change with time. So one of the most important things you can do is have a doctor and work with your doctor to know about the health of your heart and the health of your arteries. And is there anything you can do or do differently to maintain best possible blood flow? So I mentioned that one of the key things that's also important for blood flow is to actually have a reliable heart rhythm. And changes in our heart tempo and rhythm are a natural part of aging. That's going to be our next talk. And I got to tell you, that's actually probably the most important part of cardiovascular aging for the upcoming century. Like I said, heart disease 100 years ago was rheumatic fever. 100 years ago, if you got strep throat as a kid, that infection could chew up your heart and the heart valves don't work and the heart fails. doesn't really happen much anymore because we have antibiotics. In the late 1900s, we had antibiotics. People didn't die of pneumonia, and heart disease wasn't rheumatic heart disease. Heart disease was atherosclerosis, which is natural aging. And arteries grow plaque and they clot off, and we kill off the heart or the brain, have heart attacks and strokes. We can entirely prevent that now, and most everybody. So in the 21st century, heart disease is becoming an issue of pressure. Well, we know how to manage that. Don't let the heart fail or get poor blood flow for over or undertreated pressure. But the heart also becomes more irregular. That's something we can't entirely prevent. We just have to accept, look for, and manage. And it's the most important thing facing us as we have an aging population into the 21st century is maintaining an adequate rate and rhythm. So that'll be our next talk on Real Doctors, Real Medicine. I'm Josh Yamamoto. Thank you for your time.